Mr. Johns.
1.5 minutes, please.
Thank you. My question is to Dr. Tanguay. And first, Dr. Tanguay, I also share my condolences to you and your family for your losses. I know, Dr. Tanguay, you're part of a report commissioned by the United Conservative Party in Alberta in 2020 on safe consumption sites in your home province. And that study has been widely criticized for its poor scientific methodology, and yet was key to the closure of the safe consumption site in Lethbridge, which has reported a record number of fatal overdoses since the closure of that site. Additionally, a study was published in the Lancet this month showing a 67% reduction in overdose deaths in neighborhoods within 500 meters of safe consumption sites after they opened. It demonstrates that life-saving impacts of these sites and the importance of them. Have your views changed since this government-commissioned report was used to leverage the closure of safe consumption sites in Alberta?
So just to be clear, the consumption site in Lethbridge was transitioned to an AHS1 out of a not-for-profit. It's still active and still going, and never has it turned someone away. There's a record overdoses in all sites, whether one of these consumption sites exists or not, whether treatment is available or not. I don't think that picking a specific small piece and saying, here's the answer is always the easiest way. Supervised consumption services, and the report never said once to shut any service down. It was never once written in that report to shut any supervised consumption service down, but rather that these services require support such as medical treatments, buprenorphine, methadone, mental health treatments, wound care treatments, primary care treatments, that the big support is that these processes should be more than under the realm of harm reduction and rather under the realm of healthcare. And that was something that was argued.
Believe, Dr. Tanguay, that there should be more safe consumption sites, including, maintaining and improving the one in Red Deer, for example?
I believe that safe consumption or supervised consumption services are a part of a pathway of treatment. And like all harm reduction services, should be a part of the treatment algorithm. I think that the biggest problem that we have is that we pick one little piece.
I'm sorry,
and then
Doctor.
we focus on it and think that's all we need, and that's not an answer. Sorry.
Thank you, Dr. Tanguay.